And we're back. Welcome to Focus and Flow Lectures. Today we will be going over the respiratory subjective assessment. Today we will look at subjective assessment for cardiorespiratory patients. What is the subjective assessment? The subjective assessment is vital for the clinician to understand the patient's current, previous behaviors and diagnoses, so like their past medical history, their past social history, their current social history, their current diagnoses, and understand what is going on with that particular patient. So there are some standard subjective assessment questions. So you want to start with the orientation questions. What's your name? What is your date of birth? Where are we? They may answer in the hospital, they may answer the specific hospital's name, or they may not know at all. And what brought you in? Are you sick? Did you have a fall? And something else happen to you? You want to ask them about their ADLs. Do they have assistance with shopping? Do they clean on their own, or do they get assistance? Are they doing their own cooking? Are they doing their own washing and bathing? You want to ask them about equipment when they're at home. Do they ambulate independently? Do they use a cane? Do they use a two-wheel walker? Do they use a four-wheel walker? Are they wheelchair bound? Are they bed bound? You also want to ask about stairs, because stairs is an important part of everyday life. Sometimes people may not have stairs at home, but if they do have stairs at home, how many stairs do you have? Are they indoors or outdoors? Do they have railings? Do they not have railings? Is the railing on the right? Is it on the left? Or is it on both sides? These are some of the things that you should consider during the subjective assessment as a clinician. So you want to think about the patient's level of consciousness. Is the patient rousable? Are they drowsy? When you enter the room, are they sleeping? Do they react to their name? Do they open their eyes? Are they alert and oriented? Oh, yes, so you want to talk about orientation. Where is the patient? Do they know where they are? Are they confused? Are they able to answer what time it is, the date, or do they not know what day it is? Do they not know what year it is? Compliance. Are they compliant or cooperative with what is being done? The treatments that they are being provided, are they refusing to comply with the treatments that are being used as intervention? You also want to think about positioning. So is the patient in bed? Are they in semi-Fowler's position? Are they in a high Fowler's position? Are they supine? Are they side lying? Are they sitting at the edge of the bed? Are they in semi-Fowler's with their neck in a flexed position? You might want to reposition them so that they are getting effective oxygenation. Okay, something else to consider is the patient's appearance. Are they pallor? Are they flushed? Or are they sweating profusely? You also want to consider, is the patient in pain? You can use the visual analog scale or the VAS. Scale rating from 0 to 10, 0 being the least amount of pain, 10 being the greatest amount of pain ever. Here we have some smiley faces and sad faces. And this is for the patient to rate the intensity of their pain or the severity of their pain. You also want to consider mood. Is the patient happy? Are they sad? Are they in between? Are they neutral, as you would say, neutral? Or are they depressed and unhappy? Are they irritable? Are they angry? Then you want to think about respiratory status. What is the patient's respiratory pattern? Do they look like they're labored breathing? Are they shallow breathing? Are they using their accessory muscles? Or are they breathing normally? These are all important things to think about when you are doing your subjective assessment. Now you want to look at the assessment of their previous history. And why is this important? Being able to read or review a patient's history is important so that the clinician has an understanding of the patient's current and prior medical and social status, because you also want to know who they live with, because they might be getting assistance from their family members, or they might have carers. And you want to think about all of this when the patient is admitted to hospital. And you want to keep in mind it is important to gather relevant information that is up to date or current with the patient's condition, and it can be applied to this current admission, because you don't want to, for instance, you don't want to go back to 1950 where they had a hip replacement, or they had a fracture in 1950, and then that's not relevant to today. So always consider the patient's current condition and what can be applied within their history to their current condition. So we also want to look at the patient's present condition or reason for admission. You also want to look at the characteristics of their illness, because this is important to analyze so that you know what type of treatment that you're going to administer to this person. You want to think about their history of respiratory disease or serious illnesses that they may have. You want to look at the medications. Some medications may cause respiratory distress or respiratory depression. And then we have social aspects that may affect respiration. So think about maybe this person worked in a building with asbestos or mold, which can contribute to COPD or asthma. You want to think about the patient's exercise tolerance. What was their exercise tolerance prior to admission? What is their exercise tolerance now? Are they exhibiting shortness of breath on exertion, whereas usually they won't exhibit shortness of breath? And then we want to think about their prior mobility level. Are these patients at their baseline? Were they walking at home independently and now they require a two-wheel walker? Were they walking with a two-wheel walker at home and now they require a platform walker? These are all important things to consider when completing a cardiorespiratory assessment. Conclusion. So the subjective assessment is important for the following reasons: to gather appropriate information, to understand the patient's prior history and/or function, and to understand the patient's current condition. Also, you'll be analyzing the information for use in the objective assessment. Here is my reference. It is the University Hospitals Birmingham NHS Foundation Trust. This was from 2025, or it's most recently updated in 2025. You can check it out as it is an online source, and it has additional information in regards to the subjective assessment. But if you have any questions, you can definitely comment below in the comments section. Thank you so much for watching. Please like, share, and subscribe. Thank you for tuning in to Focus and Flow Lectures.